I
don't know how to report.
Any additions or deletions to the agenda?
I move we accept the agenda as presented. Support.
Motion to accept the agenda as presented. Any discussion? All those in favor?
Aye.
Aye. Motion's passed. Approval of the agenda.
Oh, that's what they just did.
Same thing.
Nope,
Yeah.
just did it.
Public comment. I know we have David John from War Memorial. If you could give us, we're happy to have you. Thank you. And if you can give us a little update on the health department, so we're county borders maybe on the same page as the hospital.
Sure. Thanks for the invitation to come to the meeting. Obviously, a lot of things have changed in the last couple months here at War Memorial, but our current situation for our organization is that we're in pretty good shape as far as the stopping the virus from spreading throughout the county. For us and in our testing, we've done 252 tests. We haven't had a new positive in quite a while for us. We do now have local testing capabilities. We have the BD machine, which is a 3-hour test that is 100% accurate because it elevates the RNA, the virus, so you can test it and be comfortable that you've have a positive. We also just got from Region 8 a Abbott quick test analyzer that takes 13 minutes to do the testing. That's now up to 95% accuracy. So the problem is with both of them is that we don't necessarily have enough reagents and swabs to just have a free-for-all in testing. Right now there's a priority that we use for testing. It's inpatients, and then second is any healthcare worker that's been exposed to a positive COVID patient. We had to use that once. We did have one positive employee, and we tested 80 staff members out who came in contact with that employee, and all of them were negative. And I know a lot of hospitals are being asked by their communities because they said essential workers should be tested. And I know we've gotten some calls from various organizations, including the County Road Commission. We don't have enough tests yet to do that testing, and I think every hospital in the state is saying they can't do that testing right now. If we're able to get enough tests, then we certainly can do that. But we want to make sure we have enough tests for the patients who are really in need of it. We've set up our drive-through screening program where we hope every person in the county or community that has symptoms goes through there, because we want to segregate anybody that could potentially be positive from the clean areas of the hospital. We have 2 separate floors. One, we call it a hot floor if we get COVID patients. The other one where patients with other medical issues stay. We certainly have put in a lot of safety precautions. We screen everybody that comes into the organization. Everybody has to wear a mask. We have hand sanitizer all over. We clean a lot more than we did before. We are starting to ramp up our services based on safe protocol. The governor clarified her order about elective surgeries, that it's determined by the practitioner or the physician whether something needs to be done. The rule we're using is if it's going to reduce pain or improve mobility, we'll do the surgery. We're seeing about a 25% increase in the number of surgeries we're doing this week. Our plan is to ramp up another 25% next week. Maybe if we get the okay after that, after May 28th, we go back to the new normal, which is going to be different than the old normal. There's a lot of things that we have to put in place now to make sure the patients are safe when they come in, make sure our staff are safe. we have plenty of, right now anyway, plenty of PPE, personal protective equipment. So if something happens where we get a spike, we'll be able to handle it at this point. But overall, for the whole UP, actually, it's been pretty good. I think the majority of the cases in the UP are at one nursing home in Marquette. I think 39 of the 51 in Marquette are at that nursing home. Obviously, we don't want that to get into our nursing home or any nursing home, because those are the high-risk patients. Also, the prison system is a concern of ours because there's 4,000 prisoners out there. The National Guard is up in the UP this week doing testing on all the prisoners. We had 11 guardsmen at our facility getting tested so that they knew they were negative before they went into the prisons. My light went out. Electronic savings, timer if you don't move. It'll be interesting to see how many of the UP prisoners actually test positive, if any. But we will know what our risk is at that time. And I know the same group is going to try to go around and test long-term care facilities as well. All these tests are being done by the state and with their supplies. So it's not taking away any supplies from us. So overall, I think we're in a good position, but any business that opens in the near future is going to have to put those safety practices in place. You see it certainly if you go into any drive-through restaurant or any business that is open now, with acrylic shields to shield the workers, trying not to handle money if at all possible, or do it with a touchless system. But all those things would have to be considered if we're going to reopen the whole community at this point.
Well, thank you.
Any questions, Bob, maybe? David, thank you again very much for the explanation, and I really appreciate you being here.
Yeah, and one other thing, because I know the media, the news, you hear a lot of stuff out there. Everybody hears about this testing for, slipped my mind now, where if you had it, you can find out if you're immune to it, the antigen testing or antibody testing. I would caution anybody that is still not an exact science. I just heard a story today that there was a patient or an employee over in the Newberry area that tested positive for the virus. They've recovered, which is nice. They were isolated in their home, but 3 or 4 weeks later, the hospital wanted to test for these antibodies in the entire family. And so they did, and they found that the patient who had tested positive for the virus was negative for the antibody. One of the family members was positive for the antibody, and one of the other family members was inconclusive. So, it's nice to think, well, I want to be tested to see if I have the antibody, but I don't think the science is that far along to prove that it's accurate at this point. So if you're talking to people that say, well, why doesn't the hospital do the antibody testing yet? Well, first of all, we don't have enough positive cases in the community to worry about it. And second of all, it's not that accurate yet. And until you get to a better specificity, the test really doesn't prove anything. So just wanted to put that information out there.
Thank you. We appreciate it.
Thank you, Dave.
All right, thanks.
Are there any other public comments?
Yeah, I'd like to make a quick public comment. I'm Bree Carlson. I'm an educator for Michigan State University Extension, and May is Mental Health Month. MSU Extension has programs and resources for families to help them care for their mental health at this time. I want to share some of our free upcoming online courses that are available to Chippewa County residents. Starting May 11th, we have a Relax Alternatives to Anger. Starting May 18th, we have a Tai Chi for arthritis and falls prevention. Starting May 21st, we have a Powerful Tools for Caregivers. And starting May 25th, we have a Stress Less with Mindfulness. So anyone can register by visiting the MSU Extension website. Thank you.
Thank you. Any other public comments? One last
I have a
call.
public comment.
Go ahead.
Hello, my name is Katie Chipman Bergsma. I'm a citizen and employee of Chippewa County. Thank you for your time and commitment to keeping employees and the community safe. While we contemplate how to return to work, there are key factors that we need to be mindful of. Consistency and clear written communication is key to having a vigilant response to this pandemic. I think that employers need to supply required PPE and supplies to meet OSHA and CDC guidelines. These are all included clearly in the Michigan Municipal Risk Management Authority Model COVID-19 Preparedness and Response Plan and Instructions. In these guidelines, trainings, visual postings, and compliance are necessary for our environment to stay low risk. In the event that the public buildings will be open to the public, our risk elevates to medium immediately. It is imperative that employees are consistent and educated in order to protect themselves, operations, and the public we serve. As department heads are most familiar with each office operation and task, they should be allowed more leniency on managing employees' task, scheduling, and shift in order to safely accomplish the essential work. Mackinac County has implemented this. If we are doing essential work that requires training and licensing in certain instances, then we should be able to treat us as essential employees. We are not easily replaced, nor would our building be the same We are doing essential work that requires training and licensing in certain instances. Then we should all be treated as essential employees. We are not easily replaced, nor would our building be the same if an outbreak occurred, nor would these essential functions be completed. I've recorded my tasks before and after this pandemic started. These tasks have drastically decreased due to the lack of the service requested by the public. Downsizing is not as ideal as it would require trainings, rearrangings, and could be temporary as public service requests increase with industries being opened up. My issues with the procedure and policy, safety, and consistency alone take up another 2 minutes, but include lack of specific questions on the screening questionnaire, faulty thermometer, and other casual disregard for safety precautions. As public service industry, we have a higher responsibility to put personal opinions aside and follow safety policy and procedure to a T in order to limit risk and liability, but to also maintain these essential functions. All things that should appear in a solid Chippewa County back to work response plan that ensures compliance to OSHA, CDC, and state guidelines across the building to keep everyone safe. Thank you very much for your time.
Thank you.
Thanks, Kate.
Any other public comments? Any other public comments? Last call for public comments. Declare public comments closed. We'll move on to number 5, correspondence and information items. Several here: investment report, visa billing, healthcare for summary report, travel report, Sheriff's Department quarterly DTRF, healthcare fund report. None of this requires any action. If there are any questions, contact the administrator's office.
I just want to point out something. In going through that pile of information, I got to page 8. It talks about DTRF and funding various funds. This one is the healthcare fund contributions and earnings. And I looked through it and I got to a number of $1,992,799.49 as a loss. And that, alarmed me right away. I don't normally look at it, but when I see that big a number in parentheses, I wanted to bring it up, and I asked Kelly about it, and what it is stock market loss. And she indicated that we've already made up 500,000 of that since then. But when you look at that number, we go along and bingo, there it is. So I think we all need to be aware of this thing is up and down and crazy at this point. But thanks, Kelly, for letting me know. Maybe I should have known that before, but I didn't.
Commissioner Martin.
I'll just say, we talked about this, a couple years ago about, there are always corrections. No one saw this correction coming, obviously. But I'll tell you what, to have only lost 20% of our portfolio and to have already regained 5% of that back, doing way better than my plan. I mean, we've lost almost 35% of our portfolio. So if we kind of knew this was coming. We just didn't know when or where, but there's always a correction every 5 to 10 years, somewhere in there, there's a correction. and we just had to be solvent enough and have enough in our rainy day fund to,
This isn't the rainy day fund.
no, I'm just saying, you know, because we might not be able to contribute as much because of the correction. Or we might want to actually contribute more during the correction because our money's gonna go a lot farther. So, but that's something, you know, that Administrator German and Ms. Fazzari and.
Well, there's an investment group that looks after that, Scott.
The
Yeah,
investment
wasn't there
group.
gonna be a meeting of that pretty soon?
The investment
The
committee, I
19th.
think Scott's on that, aren't you?
Yes, I am.
Uh,
What?
Not anymore.
Oh, I'm not anymore? I used to be a proud member of that committee. No, it's you, Jim.
I don't know, is the chair on that then?
Yes.
Yep.
Oh, okay, well then I guess we'll find, because weren't there, I got an email for 3 dates, 3 different
Yeah,
dates to
I
take a
think
look
we're
at
gonna
that.
go with the 19th.
Okay,
Thank you.
agenda item, Health Department, we have Mr. Doug Walton.
Yep.
It's all yours.
Good afternoon, everyone. Just stated, my name is Doug Welton. I'm here with Anderson Tackman and Company to present the 2019 County Health Department audit. There was a graph presentation sent ahead, but due to the scenario or circumstances of being over Zoom, I'm just going to leave that open to questions. If you have any questions to me on that, I'm not going to go through it. I think it'd be too difficult due to the platform. But I wanted to start off by talking about the audit opinion, because audit opinion is really the item that you pay for in the audit. And there are 3 levels of audit opinion. A unmodified audit opinion, which means that we feel in all material respects the financial statements are true and accurate. A modified opinion, which would be we felt it was true and accurate in all respects except for a certain thing we bring to light, or a disclaimer, which would mean we would not issue an opinion. And the health department received an unmodified opinion, and again, that is the highest form of audit opinion. And then I wanted to talk about some significant changes from the prior period. And a large one was a prior period adjustment in relation to the OPEB liability in the current year, which ended up being a large swing, and it had to do with the measurement date changes in the actuarial report in the current year. We went from the 1st of the year to December 31st, which unfortunately shifted the year in which we showed a liability for the health department. At the year end, we ended with a net OPEB liability of $4,931,000 and a net pension liability of $4,600,000, so combined about $9.5 million altogether. Now that being said, on the net position side, we saw a decrease. On the fund balance side, we saw a $583,000 gain in the current period. And that relates to some prior period changes in cost settlement amounts, as well as a good year for home health and personal health, seeing drops in both expenditures related to salary and general operations. And then I wanted to talk a little bit about subsequent events. Obviously, the COVID-19 coronavirus is going to have a serious impact on next year's financials. That amount is undeterminable at this time, but I presume that there will be some drops in charges for service related to services that are currently not being offered and or are being severely limited in their offering, either through demand or otherwise. So that would be something I would say is something we should pay attention to for looking into next year. And then I wanted to open up to you guys for any questions on the report or graphs that were sent out.
Motion to accept the audit report, Mr. Chair.
Yeah, is there a motion?
So move.
Support. Motion made and supported to accept the report. I know I went over it with Chuck and Kelly and Jim today, and you know, we're looking a lot better than we thought we were with the health department, but I just want to make a comment that they are fee-based and we're not bringing in any revenue off those fees, so there's, you know, if there's a little cushion there, it can be gone in a hurry. So, any other discussion? All those in favor?
Aye.
Aye.
Opposed? Motion's passed. Thank you, sir.
Yes, thank you for your time.
Agenda item B, pink ribbon.
I'd move we accept the pink ribbon expenditure here, or approve it.
Support?
Motion for pink ribbon and support. Any discussion? If none, all those in favor?
Aye.
Aye.
Opposed, motion's passed. Central Dispatch, I believe, can we do this all in one, Kelly?
If you'd like.
Stone Garden Grant and Chippewa County Emergency Declaration Extension.
So moved.
Support.
Motion and support. Any discussion?
I have a question. In going through it, I see that part of the expenditures is a 20-foot boat. And I was just wondering, I followed along and it said it was going to the state police, that we were serving as a conduit for that, so that, because I thought, oh, we're gonna buy another boat, and I thought we had boats.
We
But
do.
this is to take care of the state police in the area. You know, does that remain in this eastern end of the UP, or is it?
I would assume so, but I don't know because of their region that they
Yeah.
have. If Missy's still on there, we could ask her, but it doesn't look like, looks like she's run away.
I believe it's similar, we did that years ago with the ROV, remote operated vessel. It goes to, it's available in this area, but if there's an emergency, they're going to go wherever I mean, if there's a disaster in Clare County or Menominee, and they should go. But yes, it does serve us.
Well, you know, I guess the other question is, does it end up back here after it goes somewhere?
They can't get rid of it unless they have the approval through the state in order to get rid of it, since it came through the Stone Garden grant.
Well,
Like on trade-in or anything like that,
Yeah.
years down the road, it's still gotta be,
So
we
many
still have to
years.
keep an eye on it.
yeah,
I believe there's a 3-year, they can't do anything with it for 3 years, and after that, they need approval to upgrade or trade it in or whatever they do.
well, I'm just curious as to where it ends up after they use it. Okay, it's on a trailer, it goes, say, to Clare County. At the end of after they're finished using it, does it return here, or
Goes back to Stone Garden.
where's Stone Garden? That's a cemetery.
I will,
It's in Washington, I believe.
Missy has a delivery right now, but I'll send her the question
Yeah,
and,
just,
I gotta believe it's gonna be stored here
Yeah,
locally.
the
They're gonna go and come back and
The
go and come back.
ROV was stored in, I believe, in, setting.
Is
Okay.
everything usually stored, Bob?
Yeah,
in
it
the east-
depends on where
In the eastern
where
UP?
their command is.
Yeah.
And it might be in Lewis County, it might be here, but it's gonna be close.
State police doesn't have a post in East County anymore, so I would think it would be,
It might be in the sheriff's garage. It's just, Stone Garden is not just meant for Chippewa County.
No.
It's meant,
I
Or
know
the surrounding area.
know the sheriff does store the state police boat in our warehouse at Kenchua.
that's probably where it is.
I would guess, yeah.
Okay,
Thank you.
any other discussion? And there was a motion on the floor and support, all those in favor?
Aye.
Opposed, motion's passed. Public Defender, MIDC. Grant, I guess it is.
we just need to approve their budget.
to approve the budget, and Kelly has gone over this with Ms. France, and if there are any discrepancies come budget time, such as if anybody asks for too much money or whatever else, the commission still sets that at budget time.
Make a motion to accept it.
Support?
Motion and support to accept the MIDC grant. Any further discussion? All those in favor?
Aye.
Opposed, motion's passed. Equalization, CSC MOU, and I guess that's EPEN recording, electronic recording.
Yep, Sharon's gonna go to the e-recording and we just need those contracts approved. She may have more to add in the future.
I'd move approval.
I will support that.
Motion made and supported. Any discussion?
Okay.
Yeah, go ahead, because I think you're probably gonna say what I was gonna
Can
say.
we go ahead and add to the motion that if she has any future contracts, that she doesn't need to bring them back here as long as they're the same as this? Or do you want to see each one?
I think we could add that to the motion. I think common sense,
Yeah, she's pretty frugal with her
you better believe it.
dog. We can trust her. Okay, any other discussion? Jim?
No, I just, I know she was, she doesn't like this electronic signature thing, and I totally understand, because it, you know, you just check a box that says, yes, I electronically, it's just, you know, but what are you gonna do? It's where we're at, you know, forever. So just have to get used to it and go, and then keep an eye out for fraud. That's all you can do.
Okay, let's vote on it. All those in favor?
Aye.
Opposed? Motion passed. Animal control.
I move approval.
Support.
Motion and support to remove and install kennel gates at $4,900. Any other discussion? I'd just like to add that we did advertise this last November, December, and we were not very successful in attracting contractors that wanted to do this project or even work at an animal shelter. We were able to find one as well within the budgeted amount, so I think we need to get it done. All those in favor?
Aye.
Opposed? Motion's passed. Administration, county staffing. Mr. Jim German.
We had this all figured out this afternoon. And then the governor, by her late announcement, extended the date till the 28th. There's a lot of sides to the issue. It comes down to a person's safety versus our economic health, which are kind of tied together. Small businesses are wondering for good reasons why county employees are getting paid with benefits to stay at home. I've talked to various commissioners, and the logical way, since the extension seems to come up, is that all employees are to return to work on Monday. The union's supposed to be given a 10-day notice, but only under the layoff clause. We're looking at furloughs. They will get their unemployment, they will get their health care. Their wage will be coming basically from the state and feds under unemployment. The furlough, it's going to be somewhat optional. You're told to come back Monday. If you don't want to, then you're going to have to find a way to go on unemployment and take that road. We will make an effort to have some people, and we're going to phase this in over the week. There will be an effort for some people to work remotely from home. However, if we cannot keep tabs on that somebody is actually working remotely from home, then we're going to stop that practice. So I would ask that the motion be, Kelly, do you want to state it?
Somebody needs to start so they can have discussion. Is it, if we are gonna come back on Monday with the option of certain departments furloughing staff since they can't keep the work where it needs to be? We've talked about so many different things. Originally, we were gonna phase the staff back into full-time, based on the department needs beginning today, because we did bring departments back we did bring a couple of people back today and have everybody back to full staff on the 11th. And then if the stay-at-home order were to be continued, then we were gonna start furloughs on the 18th. But now we already know it's the 28th. And if we furlough per the contract, we don't have to wait the 10 days. And it would be departmental wise as to who's going to furlough and who's gonna come back to work. We have talked to many of the other counties in the UP, and some of them are already back to work. Some are going back to work on Monday and actually opening to the public on Wednesday. I don't know how they're doing that. I mean, we will still be open for scheduled appointments and court hearings. Other counties are laying off. If you lay off, that means there's no guarantee of coming back to a job. If you furlough, there's a guarantee of coming back to a job. We've been all over the place for the last 3 days, trying to make the right decision, the best decision for the county constituents, and for the county staff. That's not a motion, but.
That's not a motion, so can we discuss, or?
Sure you can, informally.
I'd like to, well, I was all over on this one too myself. I think this board, the county administration, we really made a good faith effort to keep our people safe, to let them stay home, collect full pay and benefits. But I don't know if we can sustain that going into month 3. And just an example, like the health department, they're fee-based. We're losing $200,000, maybe $250,000 a month, and we can't sustain that. My general feeling is, even with this COVID-19, we might get through 2021 budget, 2022, if we don't get our finances in check and get back up and running. I foresee permanent layoffs coming, and all the departments will be forced to. So that's why I just don't want to extend it another 3 weeks, because the governor extended it till the end of May. We're kicking that can down the road, and we've been 2 months now. That's just my feeling. I think if they're uncomfortable coming back, we phase them in. If they don't want to come back, they can take the volunteer furlough. They'll still get their health care. They'll get their retirement. None of that changes. It's just they're not getting paid from the county revenue.
I think there's a couple of basic principles we can most likely agree on. One is that when the stay-at-home order is lifted, that since people in the community can leave their homes, they ought to be able to come do the business they need to do with the county government. At this point, that's the 28th of May. Of course, that's at this point. It could end up being October 1st. It just seems to go on and on and on. It gets extended and extended. So we do have to, we did really put our neck out, I think, on behalf of our county employees, and continue to pay them, provide them a safe, convenient way to try to be productive as much as possible. But we do get to the point where something's got to change. It's can't go on forever. And, so we have to start making a plan. So the one thing I think, again, that we can probably agree on is that when the stay-at-home order is over, we should be open for people to come do their business. The other thing I think we can agree on is that between now and then, people should be able to come to the courthouse by appointment or do their business remotely or whatever. That should be, So those two things are kind of bookends to, I think, the conversation. And again, I think the majority of us agree with that. Whereas what to do with the employees and when to bring them back, that's probably the rub. That's probably the tricky area when you start talking about when to bring them back and what they'll be doing when they come back, But to some, that's what we may need to make a decision on. And I'm not exactly sure what this right decision is. But I do know that we just can't continue to pay people full wage to be at home. We just can't keep doing it.
Well, it's not only the full wage, but every 2 weeks when they do get paid, you're accruing two and a half, 3 days of vacation, sick leave, personal
Yeah.
leave. And that's going on for months. I know in my district, probably 80% of the people are laid off.
Yeah.
Our small businesses are all closed pretty well. We have a grocery store and a gas station, that's it.
Yeah. And this is no fault of the employee.
No.
You know, I mean, we recognize that. I mean, it's not their doing, and it's not nobody taking advantage of anything. This is just this is where we're at, and somehow we need to do what's right and fair for everybody, and that includes the taxpayers.
Mr. German.
And I'd like to say under the plan we came up with, that I'm pretty sure of, but it should eliminate some of the grievances, because we'll get grievances either way. But at this point, the employees come back to work on Monday. If they feel uncomfortable, they choose the furlough. I don't know how that would be grievable. So I think it's a sound, logical move, but I don't think anybody in this room has all the answers on this.
Well, and if you do come back to work, let me just finish one quick thought. If you do come back to work, your exposure is very limited to, the public and the community at large.
Well, the building's still locked, only by
Sure, the
appointment.
building's locked, there's very limited traffic through, you're exposed to your coworkers. But again, the employee themselves can take measures they like wearing a mask, using hand sanitizer all the time, using sanitation on their general work area. So they can control their environment to a large extent too. And we accommodate that as much as possible.
Commissioner McLean.
Yeah, I read through this last night, and the thing that we need to be aware of is that we have a responsibility. Okay, the responsibility is, and if you look at it, they're talking about when people are in offices, that they're so far apart from each other. When they're in the offices, they all wear face masks. I thought it would be optional. We could just take a vote in the office and say, okay, let's not wear face masks. But when you read it, that's what it is. It says you wear face masks from the time you're in and when you're out in the public areas and so on and so forth. So I think if we make a move, we better be sure that we're taking care of our responsibility relative to the executive order. And there's a lot in there. I mean, there's a lot of verbiage, but you get to the bottom part of it. And what I was concerned about is the workplace. What's the workplace look like? What are our responsibilities? And if we're going to have everybody come back on Monday, we better get scrambling, because they come back and they say, okay, I want to come back. They all come in, sit down, start business, and then they say, well, wait a minute. I'm supposed to have this, this, and this, and you're supposed to be so far away, and all this other stuff.
I looked at that too, and I thought that was when you're open to the public.
Well, no, I think so. I think that when they talk later about being open to the public, it's another thing. That when you're in an office, in order to keep, spreading a contagion among your coworkers, because everybody leaves at night, they go home, who knows who they run into, they come back, and I just think we need to study that real carefully before we make any decisions. I would be saying that, as Scott says, everybody should be back and we should be open by the 28th, okay? I have no problem with that, that sounds good. But I think we need to move carefully from here to there, as far as getting people back and what the expectation, not what the expectations are, but what the letter of the law says or the executive order says relative to how we're supposed to have the workplace set up so that we control this.
And not to take away from any of what you just said, but I'm seeing people, because my business is one of the winners chosen and I get to be open, and I see people every day, and I'm talking to people who are state and federal employees, and governmental employees. And I'll say, okay, are you guys social distancing? And they, oh, no, we work together. We're sitting shoulder to shoulder each other all day. So I can just tell you that, take it for what, any way you want. But in other workplaces, state and federal governments, there's people working next to each other all the time. I'm just saying, take that any way you want and apply it if it applies, and don't apply it if it doesn't. But I know that's what's happening in the workplace and many other state and federal offices.
Well, I agree with you, Scott. I know that's happening. I mean, you see golf carts on the golf courses, okay? There's all kinds of that, but we have a responsibility for our employees here. And if you're worried about grievances, and if we don't make sure that we follow everything as is laid out, those offices are crowded. You go into the clerk's office or to the treasurer's office, people are in close proximity to each other. That needs to be studied before we do anything and require people to come back. So,
Mr. Chair.
Kelly's been waiting here.
Well, we have most of that already in process. You're screened every morning. You answer the questionnaire. We have masks available. We have gloves available. We're sanitizing almost on an hourly basis unless the guys have something else going on. So the social distancing, we have talked to the department heads. We have ordered sneeze guards for desks that don't have the right distance. So we've been proactive. We haven't just been sitting back and waiting and saying, okay, come back because we're saying you need to come back. We have been looking into it.
Well, I agree and I appreciate that. I didn't think that we were completely unprepared.
And
But-
they're even getting sneeze guards ready for when we open for our customers, so.
Well, you're
They've
talking
been
of
very
sneeze guards
proactive.
between employees.
We need one because we have a
Okay.
desk that butts up to each other. And
But-
we'll put in, if it doesn't get here in time, we'll put in a piece of cardboard.
Well, my point being,
That's,
particularly on,
Mr. German, yeah.
Kelly's exactly right. I think we've been very proactive. I think we've taken all precautionary measures we can, which will be in maybe by the end of this week or next, these sneeze guards. We're encouraging employees to wear the face masks, but I will say, after getting an opinion from an attorney, that you can't really order them to wear the face mask because all they have to do is say, I have a medical condition, I get rashes when I wear them. And that's put right out into the law. And so we can strongly encourage, as we have been, but to make them, if they claim a medical condition and you can't even ask what the medical condition is.
Jim, that's the fine line, okay? And I saw that in there.
I know.
And I appreciate that. But the thing is, I guess I would have to ask, is there a reason why you can't wear your face mask? And if they say, I have a medical condition, case closed.
Right.
Okay? But if we don't ask everybody, okay, or tell them that you have to wear a face mask unless you have an issue. If you have an issue, come forth and it'll work. We can make it work.
Yep.
But there's the difference right there, and that's the difference between winning a grievance and losing a grievance.
You're
You know,
right on
the-
the same page, Doug.
Yeah, and I'm kind of on the same page with you too. It's just that, the executive order said everybody wear a face mask, and that's what you're alluding to, unless you claim you need an accommodation. But the problem is 2 sentences later it says, but there's no penalty for not wearing a mask. So you say, how's that not become advisory when you say right there is no penalty? Well, if there's no penalty, well, that's like saying the speed limit's 70, but there's no penalty if you go 90.
But that no penalty clause doesn't enter into a grievance process.
Well, that may be true. I don't know.
I mean,
That's-
there's no penalty by
that's
law.
different.
You're not going to get arrested for it. But if we allow something to happen in our workspaces, and because we didn't ask, and again, if people have an issue with it, then fine. But I think in order to be in the right spot, we need to ask them about that.
Well,
the
I
other thing
don't
is-
see why it would hurt at all, is to get this conversation going.
Sure.
That we tell the department heads and the elected officials, if we can tell an elected official anything, that we say, would you please ask your employees why they're not wearing a face mask? If they say, I don't want to, or I have a medical condition, it's dropped, but at least we take your advice and we ask.
The I don't want to doesn't fit in here.
Okay.
Okay, that's not an option. If you have a medical condition, you don't have to spell it out, but you have to declare it.
Okay, yep.
Okay, and the other thing is telling elected officials, we're not telling them, this is our policy as the county, okay? They can argue with us, but they don't have a leg to stand on because we as a county are determining how we're going to do this. And we are responsible to make sure that this is done right. Not the elected officials out there, we.
Well, I think you're exactly right, and I don't think it should be so hard for an elected official to say, hey, how come you're not wearing a face mask? And is that what you're getting to?
I'm saying, I don't want to dump it on the elected officials, I'm gonna dump it on you. Okay? You go and explain to the group, or as they're coming in or whatever, that when you're in the building, you have to wear a face mask, unless you have a medical condition that precludes that.
Okay.
And if they say, I've got a medical condition, done, we're done. But everybody else should be wearing a face mask.
Kelly?
Is that just for employees, or is that employees and visitors?
Well, visitors coming in the door to me should wear a face mask. We should require that. That's one of the requirements I'd have. And I'll tell you, there's getting to be fairly good compliance. Sitting at Walmart waiting for my wife to come out, over two-thirds of the people were wearing face masks in and out. Okay? They're recognizing, I think a lot of people are recognizing, the ones that don't have camouflage and machine gun over their shoulder, that, it's common sense. Why am I wearing a face mask? I don't want to catch it. And I don't know where you guys have been. I got a whole bunch of them my wife made for me. But it's a risk we take. I mean, you just look at the categories, I fall right in that, the at-risk group. So I think we have a responsibility in order to save grievances. And if the rest of the UP is happy with what they're doing, that's fine. But here, we're the ones responsible for what happens in our buildings.
Well, there's a difference between face masks, making it mandatory, and recommending. So,
I'm frankly getting pretty sick of mandates.
so, yeah.
Well, and also, we have to realize the courts. They live in their own world,
That's right.
and what they want to do with their people, you control the funding, which they'll take you to court and everything like that, but basically, they're living in the ivory tower, and just so you're aware.
We're not fooling around with the courts, okay? They walk in a different path.
Yeah.
And, I don't want to fool around with that because they are answerable to somebody other than us.
Right.
We're not the ones. We're the ones that are answerable for this situation.
And they're coming
they're-
back to work on Monday.
But they're in our county buildings, they're coming through our county buildings, and that's creating two classes of how people are being treated.
That's right. But
That
that's-
doesn't strike you as being problematic?
Well, I don't think it's problematic because they have to answer to the judicial, whatever it is, down in Lansing. They have their own rules, Scott. We've been battling with that and having a hard time with that right along, but that's not the argument here.
So they get one set of rules outside that door and one set of rules inside the door?
However they want to do it.
Before the meeting, there were
Employees.
two court employees in here talking to Mr. German and me for 20 minutes. They're not wearing masks.
That's the court's responsibility. That's the judge. They're the ones that, think they're gods.
They're county employees.
Well, but they have a world of their own.
Well,
And I'd say anything that anybody in the court employs.
I'm in favor of recommending it. but Highly
I'm sorry,
recommending.
I am with you. Part of it is, I know we want to talk about the science and the the WHO's recommendation that a month ago was don't wear a mask, then they change, oh yeah, to wear a mask. I don't know how the science on masks could change that quickly after having masks around for 100 years, but I think people, frankly, are getting sick and tired of being told what to do. I understand there's health risks, and I take it seriously. I understand, but I also look at the big picture, and I think we need to move as a society more to recommendations, guidelines, and education than mandates. And that's probably a lot bigger conversation than we need to have right now. But that would influence how I think we should be approaching the opening of the county.
And we're not really opening the county is open. We're just calling our people back to work because there's work to be done.
Yeah.
And if they're that uncomfortable, they want to volunteer for a furlough and keep their retirement, keep the health care. That's the best we can do for them.
And you need to start kind of gearing up. I happen to know, because by talking to a couple of the employees, that the bridge customs and immigration people, they're starting to staff up and gear up and getting ready for their opening. Now, they don't do that on the day before they open. They're starting now.
Right. And we have, if we call them back on Monday, that gives us a couple of weeks, unless the governor extends it again, which I anticipate she will.
I don't, well, whatever, that's in the crystal ball area, but I think that we have to, again, mandate the face mask if they have a condition, and even if they don't have a condition, if they say they do, that's fine.
Here's my question. Based on, because I'm not really good on the whole union issues and grievances and all that. That's not my strength area. What I want to know is what Commissioner McLean's talking about in grievances. Are we in a better position if we proactively instruct employees to wear it and to tell us that they have a health condition and they're not going to wear it because of that? Is that somehow helping us in the whole grievance and union?
Yep. Because then that becomes their choice. Excuse me.
No, that's all right. I respect your opinion on that. I just want to know from these guys, because I know they deal more with it.
I don't see it.
I guess I'd look at it as a policy that says, or an email from the administration, we strongly urge you to wear a mask. And I don't see why it would hurt.
Well, we just tell them you're expected to follow the governor's executive order.
There.
Fine.
There, I'm good.
That's what it
Okay.
says. That's,
Because if you want to say everyone's expected to wear a mask, but I guess what I'm not comfortable with unless we have to, is singling each person out, saying, hey, you, how come you're not wearing a mask? What I'd rather say is, you're expected to wear a mask. If you're not wearing a mask, then you're not wearing it because you're declaring you have a medical accommodation.
that's fine.
Martin, you've been raising your hand.
Yeah, I've got about half a dozen questions here. First off, with the furlough, they get to keep their insurance for how long? Because we talked about it before.
As long as they're furloughed.
Okay,
No.
because I thought we had heard it's only good for a month.
That's layoff.
Well, that's what I mean, I'm trying to.
The normal thing, I think, if I'm right, Kelly, is 6 weeks. But Blue Cross Blue Shield has put into an effect right now, and you don't know when they're gonna lift it, that can be extended. So they would keep.
I just want to make sure our employees know, because I've heard different things, and I imagine they probably are
We are
too.
better off to, I'm sorry, we're better off to furlough them because that will maintain their benefits. If you lay them off per their contract, they're only gonna have health care for 6 weeks. So that's why we're trying to use the
Sure.
terminology furlough.
Sure.
So that we can give them a little bit of peace of mind. I think I said before that if you use layoff, there's no guarantee we're gonna bring them back. If you use furlough, there's a job at the end of this.
Okay. The other thing is, I've been in the building next door way too much the last week or so, and they have been very proactive, and they've got some great ideas, not only to get us ready for Monday, but to get us ready for when the governor lifts the order. As far as sneeze guards and all that stuff, there's the one desk, but they really are, they've been very, very proactive at that. As far as everyone coming back, I just think that's the fairest way to go, because there seems to be thinking, well, how come these people this, how come these people that? Okay, we end that, everybody come back to work. Real simple, and we will find enough for you to do. We have to get ready to open up. It's gonna come. It's thrown in the courts right now. We could get a decision that's being fast-tracked in the courts that the governor's state of emergency and shelter in place could be overturned in 72 hours. I mean, we don't know, or it could be in 72 days. We don't know. We just, when that order comes, or that order expires, or that court decision comes, we need to be ready to move forward. And that's why we have to fast track all the guards in all of our offices. Be ready to open up, because we are going to open up at some point. Also,
May I ask, Mr. Martin, does that include the option when we bring them back, let's say it's Monday, that they have the option to say, no, I'd rather be furloughed?
yeah, I thought that's what we were talking about.
Yeah, I just want to
Now,
clarify.
As far as working at home, if people want to work remotely, I would just tell you at the schools, what they're doing is you have to keep a contact log. Who you talk to, how long, and that's and you turn that in at the end of every week, so that if we do have people who don't feel comfortable, but who don't want to be furloughed and can do their job at home, those people could do that if they keep a log. There's got to be a safeguard. We can't have people just sitting at home doing, we don't know. I just think that's fair, but it sounds like for our employees, there's few and far between where we're going to have people who can still work at home to alleviate the crowding that we have. But the offices, I think, are, with the one exception, are spread out enough that we can practice safe social distancing. As far as the masks go, strongly recommend, and I would even go so far as to say, sign a waiver. If you're not going to wear one, I don't want us to be held culpable or in some sort of litigation because somebody got COVID-19, which we all know you can't tell where you get it. They could have gotten it. They could have gotten it at McDonald's. They could have gotten it someone they brushed up against at a park. They could have gotten it at work. Lord knows where they got it. But I would say if they're not going to wear one, that they should sign some sort of waiver, and that's where you might have to. They're not going to wear a mask here at work.
If the order says you need to wear a mask, how is it enforced?
Well, we can enforce.
How can you enforce?
We can enforce anything we want on our employees. If we tell our employees they have to wear a mask, and I'm not saying we should, but if we tell them you have to wear a mask and you don't,
Well,
you can suspend them
are we forcing them to, or are we recommending
But
they do?
I just say
There's
we
where we're at.
strongly recommend
Yeah.
that you wear a mask, and if you don't, sign a waiver so that we don't get stuck in court because they say, well, they didn't make me wear a mask, or they didn't tell me that I should wear a mask, and then they're suing us or filing a grievance against us.
I think you're right on that, Jim, but I don't know about signing a waiver, but I would say that there's documentation that each group was talked to and explained. And if they don't have to sign anything, and if they don't wear a mask, then we're assuming that they have a medical condition.
So if we send out a email to all users saying the Chippewa County Board of Commissioners and administration strongly urges you to wear a mask, would that be suffice?
I think it would be, you're required to wear a mask unless you decide you have a medical
And we'll
condition.
make them available.
Yes, I think we have to. Do you, I know every year, we have to watch a little video thing, OSHA thing on safety things. Is there anything we can come up with that? Say, hey, this is why it's important so that our employees are educated by science, instead of by TV or what they're seeing in Lansing or what they're seeing down the street, that, hey, this is why you should wear a mask. If they choose not to,
I
then they
don't-
choose not to.
I don't
There's
think it's up
webinars-
to us to
there's
educate.
webinars, Jim, all the time that come across people's desks. And they're, some are lousy and some are educational. And they go to.
What about this? What if you send the PDF file of the governor's order to every employee and say, be advised, you're expected to follow this?
There you go. That sounds reasonable.
And these are
Scott.
the reasons you should, with some science behind it, as
I
to
guess-
why they're supposed to wear the mask. And then if they don't, they don't. I'm not,
But you
I'm
know
not
what? I mean, I can
advocating-
give you reasons why not to wear the mask. I don't think we even go there. Just say, you're expected to follow the governor's orders.
Yes.
You
I
know,
like that.
and because
I left my mask out in the car.
And
sorry.
point out the mask thing. That's, draw special attention to the mask thing, because that's
Well,
where the argument's gonna
We
be.
got a lot of emphasis on the mask. The real issue is, are they coming back to work?
exactly, and you're right, but that,
And I mean,
you're right.
they go together.
So what we're talking about is the employees come back to work on Monday. They have an option of saying they don't want to, and they would voluntarily enter furlough. Is that correct? And we maintain the hours of the courthouse availability through appointments and remote access. And we open the courthouse in this building as well, when the stay-at-home order is lifted. Is
It's
that,
almost the exact motion, right, Kelly?
is that right?
It covers everything I thought we
Is there
talked
anything
about.
I'm missing? Oh, and we shall send every employee a copy of the governor's executive order and advise them they're expected to follow it. I'll make that a motion.
Okay, and I'll just ask Scott if you would say in what we send there, we put a note saying to pay particular attention to face masks.
I think there might be one slight legal hang-up. Yes, you can send something, but unless they acknowledge they received it, we run into that with the administrative grievance and all that. Wasn't. I mean,
How about you
send something.
Put a copy of it on everyone's desk. How about that?
Whatever.
Well, just have them sign a thing, said that they have been given a copy.
Yeah,
We don't even have-
department heads can do
Yeah.
that.
I mean, we do that.
Yeah.
We
So
we do
we
that
can
in
deal
school
with it.
all the time. all the
If
time.
you receive it, you don't have to read it, but we want to know that you received
Yeah,
it.
they make us read it.
So I think that sounds like a reasonable approach to it.
So we'll do the email, and we'll do a piece of paper given out by the department heads and saying, make sure the employee has been given an opportunity to read this.
Yep. And send me a copy too.
All right, so in the rest of the motion, and everybody is pretty clear?
Yeah, you should-
I'll support that.
I mean, Kelly, can you repeat that just so we're.
Good luck with that.
We-
Wow, come on.
Sure, Mr. New Chairman. I have it in a couple of places, so that the staff is going to return May 11th, or they can voluntary furlough
Yeah.
through the end of the stay-at-home order, if they so choose. We'll still be open for scheduled appointments and court hearings. The building will open upon the governor's order, and we will send the governor's executive order highlighting the mask area and encouraging and recommending that they wear the mask unless they have a medical condition.
Maybe
Yep.
strongly recommending.
Yep. That's,
Is that,
Okay. We're
I'm not going with the strongly.
no, it's,
recommended.
Scott, it says right in that the executive order's enough. If they.
That's why I'm saying, I think that's a good compromise.
Whether we recommend or strongly
Here's-
recommend, they're gonna do what they want to do.
Oh, that's right, right.
Any further discussion?
I hope not.
All those in favor?
Aye.
Opposed? Motion's passed.
I just want to comment, I think that was a good compromise. We worked that out. And again, what people do individually, so we've covered ourselves. We've covered our liability a lot.
And I'd just like to add that we do care about our employees. We really care on the health, their safety, but we have to balance that with the needs of the public. We have to also balance that within our financial means. And is what it is. If we don't do it, we're gonna pay later.
Yep.
And on that, there was one thing that was discussed that I would disagree with. I think once we get the vaccine, the economy's gonna pick up, it's gonna turn around. Next year, I think 2021 is gonna be a rough year, but once we got that vaccine,
I sure hope you're
I
right.
think things will really pick up. Pent-up demand will pick up, our tax revenues will increase. I don't really have the doom and gloom a year from now. I really don't. I think we'll be back to normal. Instead of, we got new normal until we get a vaccine. But once we get that vaccine, we can go back to what it was like. Remember November and December? Wasn't that?
Well, I sure hope you're
It's hard
right.
to think that far back.
Mr. German.
I'd just like some advice from the board. If the contract says if we lay people off, then I have to contact the unions and I have to give them a 10-day notice. But if the contract does not address furloughs, then why not just leave the union alone, wait for a grievance and see what happens if one appears? Or do you think I should be contacting the union and say, even though furloughs are not mentioned in the contract, I'm telling you, and then it will start to catapult. It's already gonna catapult from people around. So I don't think it's best to do that. I just wanted your opinion.
I think furlough is management rights. It's not covered under the contracts. We looked into that today, and we can't add language to the contract that we're gonna discuss furloughs, because that's a violation of the contract. It isn't open. Furloughs is a management right, and it's based on financial concerns and needs. And it is what it is.
I agree. So if it's okay with you guys, I'm not gonna take the initiative.
Well, I think, we define what the furlough looks like, or somebody defines a furlough somewhere. But we shouldn't be going to them and telling them what they should be doing to do their business. That's their job. Let them worry about it.
To me, county government is an essential service. And we are at minimal staffing. We have been at minimal staffing. The clerk's office, the treasurer's office, registered deeds been overworked for years. And we haven't added staff. We're at minimal. And requiring our people, to me, they're all essential employees. And if we don't have quite enough work, Commissioner McLean, I've heard you for years talk about cross-training.
Yep.
There are things we can do that's positive, and when the governor lifts the stay-at-home order, we're up and running at 100%. So I view our people as essential. County government is essential. There are a few exceptions that can totally do their, maybe I'm going to say an example. I don't know, it doesn't apply to Kelly, but maybe payroll. I don't know if they can do that at home just as well they could sit in the office. And if that's an option, then I think we should consider it. But our people are essential employees.
But with construction and real estate and things, and I hope road construction picking up here, business is fixing to pick up in the county building, and we need to be ready for it.
And Bob is right, we're essential. The tattoo parlor is not.
That's right. We are essential. We have to maintain certain level of services. The sheriff, the courts, the registered deed, or the clerk, the treasury. Those are all essential services. And now that construction is up and running, the register of deeds and all of that, the building inspector, those are all essential services.
Yeah, I think building inspector is called back today.
Yes.
Yeah.
Yep.
Yeah.
So
I just gotta say, if you happen to be the guy that owns the tattoo parlor business and you got bills to pay, you think it's essential, and I ain't disagreeing.
I
Yeah.
understand, but I think the courthouse is very essential to a much larger proportion of the public, even though you're right, if it was my business, I'd want it open. I need a haircut pretty soon, you know?
Wasn't gonna say anything.
Bob, I just want to mention that the term cross-training is mentioned in the executive order
Oh,
as a way of, smaller counties, so people can switch back and forth. And I think that we need to be looking at that as much as
well,
possible.
I think it's a good idea.
Yeah.
Maybe we have a week to do that now.
Well, the other thing too is, should someone get sick, should someone get COVID, they're gonna be out 2-3 weeks. A lot of stuff can't just sit around and wait 2 or 3 weeks.
That's right.
You'll have, if that were to happen, you'd have multiple people out based on the guidelines that we have to follow.
Yeah,
Because
that's right.
people would be
Right.
sent home for 14 days.
Yeah.
I mean, that's,
Well,
yeah, we could, an office could truly be shut right down if if someone were, because you have to follow those guidelines.
And
If someone is diagnosed with COVID.
we deal with that if it happens. And that's, and that employee should be paid.
Oh, yeah.
They should be paid even if they were fertile. If they're truly have it, we want to take care of it.
Well, the thing that David John mentioned is that there is testing available, and I think they would qualify for that situation, that you could test the other people in the office
Right.
and determine if they have it. But it's going to be a scary thing. It's going to be like trying to put a lid on a kettle when it's boiling hot.
Can we move on?
Yep.
I think we beat this horse to death. So unfortunate we had to make this session, but it is what it is. Number 6B is COVID-19 preparedness and response plan.
This was
Does this change things here, Kelly?
This is just basically everything that we're doing, the screening questionnaire that we do need to make a couple changes because we need 2 screening questionnaires downstairs because we should have one for the employees, one for the visitors. This was a model from MMRMA that was given to MAC. There's a couple of webinars that are available if you want to sit through that and listen to what they have to say. Both Missy Robbins and I sat through the first one, and they're basically just going through what the CDC says. Wash your hands. If you're working in the healthcare, the PPEs, just the basic stuff. And this is what is part of the executive order as well, that we need to pass one of these. And if you get into it regarding confirmed cases, it explains what you need to do. And that's just what we did.
Got all the exits covered on it then, that we know at this point.
As far as I know, I think we do. And that's another reason for bringing the staff back in, is in case, we've been going there all the time. Maybe there's something that we walk by every day and we just don't notice. So we need the staff back in there to say, hey, did you think about this? Oh, no, we didn't, so.
I'd move acceptance of the COVID-19 preparedness and response plan.
Support.
Motion made and supported to approve the COVID-19 preparedness and response plan. Any further discussion?
Does this have, like any expiration? Because, there's a lot of measures that are in here that probably wouldn't make sense 6 months from now.
Right, I think that's why they labeled it the COVID-19, and I would guess, or I would hope that's when it will, what's the new normal gonna be? And I know somebody doesn't like that terminology. Who is it? You?
No.
Oh, somebody, if I said new normal in there. Because this is specific to COVID-19 preparedness and response. I don't think it has an expiration.
Well, okay, so the question is, for instance, we're doing screenings, are we gonna do screenings forever?
Right.
Or when are we gonna stop?
When they get the vaccine.
Say the vaccine.
That question was asked during the webinar and nobody has an answer.
I would say vaccine.
Well, okay, but it doesn't even say that.
No.
It just, my point is, this is just goes into infinity.
Well,
And there's a
it
lot of
does,
measures that.
but like you said, liability earlier, this is what they're recommending we adhere to and follow. It's a guideline from our insurance company.
It's mandated from the
Yeah.
governor.
Yeah, so I would hope you're right, Scott, that down the road, we can eliminate a lot of this that no
Well,
longer applies.
Okay, but how does that happen? I mean,
I don't know.
I mean, is this something we have to just revisit at every meeting, or
No.
is there a, how do you do it? Because
I think we're gonna arrive at a point, hopefully, Scott, in a year from now, that we would say that we don't do, or sooner, I hope, that we don't need to do the inspections anymore, or this type of thing.
Well,
I guess
when the county building opens, I don't think we have to do screenings.
Oh, yeah,
Oh, I think you
Do
will.
we?
that's when we
Well-
do we,
Okay.
again, but I see where you're talking about, Scott, but hopefully this doesn't happen, but I have a feeling that there's gonna be some other kind of a health problem that comes along that's gonna fit this criteria, heaven forbid. But,
I would think, this came from the state or from our insurance or both?
State mandated
State
it.
mandated it.
Okay.
And the insurance company gave a template out. Kelly and Missy went through it, and
Because I would think as soon as we get a vaccine, the state would unmandate it. Because why would we need it? I mean,
it's if everybody
I mean,
gets
once the vaccine
vaccinated.
is
Vaccine.
available to vast majority of us, I wouldn't think we would need any of that. Although I'm not sure we have the power, Scott. We wouldn't have the power to throw that in the shredder.
Well, I do know.
Of course we do, it's our
If we
policy.
don't enact it, we're not.
I mean, without opening us up to liability.
Well, I guess that, we need to do this end of it, where the other end of it is 10 years down the road from now. We
I
can
think
deal
we're
with
months
it then.
away from
I would,
having to deal with it.
So here's my point, is let's say you get to August 1st, and in the entire state of Michigan, there's very few cases, and there's almost no new cases. Nobody anywhere is doing any of this stuff anymore, but yet we got a policy in place that says everybody gets their temperature taken, everybody gets screened, everybody has to do that. At what point do you say, no, you don't have to follow that anymore? Do we just ignore it? Or do we, you just gradually start to ignore it? I mean, I don't like policies like that. I like policies that are either followed or not in place.
Can we put on the bottom of it that it'll be reviewed in 6 months or a year or whatever?
I personally, I think that's way too long. I think it should be reviewed every 30 days to see
Okay.
what parts make sense and what parts don't.
Then
do
put
that.
that in,
Put that on.
add it to the thing, reviewed every 30 days. That's
Put
easy.
that on our agenda every finance meeting.
Well, I mean, it could be reviewed by the administration to bring forward for a recommendation.
Oh, I like that better.
Because there could be vast elements of it that you say, look, we're not gonna do this anymore, or we're gonna suspend these parts. And if we need to reinstitute them, fine, we bring it back as needed. But a lot of this, maybe it's the optimist in me, but I'm hoping that within a matter of a month or two, that nobody's doing this stuff anymore because you're in the middle of the summer and there's hardly any cases anymore. That's what I'm hoping. Hope I'm right. But if I'm wrong, we got it. If I'm right, then we can start yanking it back.
First time in years, Scott, I hope you're right.
well, and I know the chairman has had some differences of opinion with the governor, and he'd like to go down and meet her, and we pay for that trip, and he can meet her and he can say, hey, take this and.
Would you like to leave right now? I'll drive. After today, I'd like to go talk to her. In fact, I got her cell number. I wonder if it still works.
Okay, we did vote on that, did we?
Yes.
Okay. Item 7, finance claims and accounts, basically approve the bills for county and the health department.
Move approval.
I'll support we pay the bills.
Motion made and supported to pay the bills. Any discussion? Not. All those in favor?
Aye.
Opposed? Motion's passed. Committee comments. Myself, I think I said enough tonight. Mr. McLean.
I guess I want to say that, and I'll try to remember to repeat this when we're going to be on camera for the public, but I got phone calls from people who are affected by the ferry system, and they indicated that they felt very comfortable in the direction that the UPTA board is taking. They complimented Mr. German on his influence and and for the first time, people are saying we're moving forward on that. And I think Jim needs credit for that, and I think we get some credit for it because we were wise enough to send Jim take care of it.
Thank you, Mr. McLean.
I said I wasn't gonna say anything, but I had a call yesterday from a small restaurant owner to thank the board for waiving the license fee. First one I've had, and they took the time to call me because they're in my district.
Very nice.
Motion to adjourn.
You can't make a motion to adjourn.
Motion
You
to
do it.
adjourn.
No, I was just whispering.
You whispered awful loudly.
Hey, they called me a commissioner in the paper. Come on.
Yeah, that's right. Well, Kelly can second it then.
Are you gonna second?
Did you make the motion?
No.
I make the
I
motion.
was gonna say I did.
I
Okay,
support it.
motion, support to adjourn.
Aye.
Aye.
I'm
You're
going.
Meeting's over. Thank you, gentlemen, ladies.
Spending 9 hours staring at a computer screen.
This is a very unfortunate thing we had to do.
Actually, it was a fortunate thing we had
Thank you,
to do
everyone.
because we're bringing people back.
Well, yes, I mean,
And that,
I
you
don't
know,
like having to